Locally, medical experts across the Twin Cities say that the president testing positive for COVID-19 is a good reminder that the virus is still around and still a risk.
John Lauritsen spoke with a doctor about the trends and treatments.
It's a warning that you and I and everyone else should try our best, to practice caution.
As people in downtown Minneapolis reacted to the news about the president, local doctors say it underscores an ongoing battle with the virus.
But it does hopefully bring new light to the fact that this is still a disease that is present and unfortunately growing in some cases.
Dr. Kate Hust of Hennepin Healthcare has been treating COVID patients since the initial outbreak. And even though the symptoms haven't changed much,
cough, trouble breathing, sore throat, we may see runny nose.
The age of those getting COVID has expanded.
We have perhaps a younger age range that have been included over the last several months, and that maybe people are a little bit less ill than they were in March and April, though we suspect that's also a function of the types of people who are getting sick more commonly now, which unfortunately is a little bit more of a younger crowd.
That younger crowd includes college students and young adults. Dr. Huss says treatment still varies as much as the symptoms do. In most cases, people are able to recover at home with the help of ibuprofen or Tylenol. In more serious cases, hospitals are giving patients a variety of treatments.
Plasma can be used in some cases to help people who are very ill. Sometimes that means that people need respiratory support or they need to have a breathing tube added to help support the inflammation that's happening in their lungs as a result of COVID. Remdesivir is another one of the medications that at times is used.
And Dr. Huss says that the virus continues to treat people differently. She's hoping the president and First Lady's positive tests are a reminder to take it seriously.
Our hope is always anybody who has infected has a mild course, and best case scenario, in a couple days they feel better, finish their 10 days of quarantine, and actually feel great by the time they're done.
In Minneapolis, John Lauritsen, WCCO 4 News.
And doctors say the same prevention protocols still apply. Wear a mask, stay socially distant, and continue to wash your hands.